The etiological agent of Kawasaki disease is highly infectious, but only 1% of the infections develop symptomatic Kawasaki disease, a mathematical model. The incidence of Kawasaki disease exhibits a seasonality. This suggests that Kawasaki disease is of either infectious or allergic origin. However, 97% of the Kawasaki disease patients develop this illness only once in their lives. This implies the presence of lifelong immunity. Kawasaki disease is rare below 6 months of age, and therefore maternal passive immunity seems to exist. Overall, it appears that Kawasaki disease is most likely infectious. We predicted the characteristics of the etiological agent of Kawasaki disease by applying a simple mathematical model upon the data from Japan's nationwide surveillance of Kawasaki disease. We assumed that Kawasaki disease is an infectious disease which confers lifelong immunity against the development of Kawasaki disease. We expressed the proportion of susceptible children who have not experienced an infection with the agent of Kawasaki disease as V bracket T, where T denotes the age in years. The rate of change in Vt can be expressed in the following differential equation, equation 1. Delta V is equal to minus lambda multiplied by V multiplied by delta T, where lambda stands for the force of infection of Kawasaki disease. That is the probability at which a susceptible individual is infected with the agent for Kawasaki disease in a year. Equation 1 holds true for a persistent infection if the incubation period is not very long. Equation 1 can be transformed into equation 2. Both sides of equation 2 are integrated as in equation 3. By definition, all the children are susceptible at their birth, as in V at 0 is equal to 1. Equation 4. Therefore, equation 3 can be rewritten as the definitive integration equation 5. This can be solved as in equation 6. Equation 6 can be transformed into equation 7. The following approximation holds true for a pathogen which confers lifelong immunity. Lambda is 1 divided by A, equation 8, where A denotes the mean age of patients. We incorporated equation 8 into equation 7 as in equation 9. Between 2006 and 2010 in Japan, the incidence of Kawasaki disease was 10,115 per year for children between 0 and 4 years old, which is statistic 1. During this period, the national number of births was 1,082,997 per year, which is statistic 2. By dividing statistic 1 by statistic 2, we can estimate the probability of developing Kawasaki disease by the 5th birthday is 0.9%, which is statistic 3. Meanwhile, the mean age of patients of Kawasaki disease, that is A, was 2.4 years, which is statistic 4. A of 2.4 years was substituted into equation 9. As a result, V is 0.12 when T is 5 years, which is statistic 5. By definition, the probability to be infected by the agent for Kawasaki disease is 1 minus V. Therefore, statistic 5 implies that 1 minus 0.12 or 88% of children are infected with the agent by their 5th birthday, which is statistic 6. Division of statistic 3 by statistic 6 gives the estimate for the probability at which an infection with the etiological agent for Kawasaki disease develops the symptoms of Kawasaki disease, as in 0.9 divided by 88 or 1% by the 5th birthday. It was estimated that most of the Japanese children, or more than 80% of the children, are infected with the etiological agent for Kawasaki disease before their 5th birthday. Only a small proportion, approximately 1%, of these infections develop Kawasaki disease. We are grateful to Professor Yoshikazu Nakamura and Dr. Mayumi Yashiro of Department of Public Health, Jichi Medical University. Thank you very much.